have differential diagnosis, even a little difference will be there in the treatment. You can take the stance if you want. In the vishwachi, generally this is mono organ affected in the one hand, one-sided hand, and generally right, because the human works more prominently in the right hand. So right side is more common. Here the patient feels pain, shooting type of pain from the cervical or amsa pradesha towards the fingers, towards the lower side. This may be lower side or going up upper side. This is the difference between the two. Clinically, according to the symptoms, these are the changes. Starts from the fingers in the vishwachi and peripheral side to shoulder. From here it is shooting type of pain. Whereas starts from amsa pradesha and towards peripheral side, lower downward movements. Urdhvagama, adhogami. This is related to vata according to eye. And in the pathology, sira and kandara are affected, whereas in sira snayu vikriti. This is the difference, pathological. And there is no referred pain in the vishwachi. Only the same area is paining. And supti is present. Supti may be there, numbness. Whereas in the avabahuk, there is no supti, referred pain will be there. One side is having the pain and the same other side also having the pain. And amsa sandhi karma normal. Shoulder. This is normal. Whereas here, karmalpata will be there. This is more related with the frozen shoulder. And other thing is this is clearly neuralgic pain, nerve root pressure, generally caused by the cervical bone changes, generally changes, or maybe traumatic. In that one, pain starts. And here, along with the frozen shoulder or other maybe muscular pains also may be there, and even cervical spondylitis causes both vishwachi or avabahuk. Avabahuk means hand is unable to move. It's akarmanyata, very less work. This is the difference. In the treatment, here generally we give not kuchala, here we use kuchala. This is the main difference. In the treatment, where kuchala won't work that much.
What do you use in kuchala?
Naksomita, Vishatimrita,
Kupilu.
Navajivana rasa, Kupilu.
So kupila in avabahuk.
Vishwachi.
This one, this is for just reminding you.
Kupilu in avabahuk we use or no?
Pardon me?
Kupilu we use in avabahuk.
Both we can use. But preferred one is Kupilu is here and here Mallasindu. It is not easy to use. If they are experienced and control over the medicine, you can use it. But that works are different. Kupilu will not, this Mallasindura will not work here. Whereas Bhradva Chintamani works in the both.
Which one?
Vata Chintamani. Vata Vidhamsana works here. In the avabahuk. Ekanga Virarasa works in the vishwachi. There are some medicines differences are there. But simultaneously they work each other in each other.
Sir, so we can give Kupilu in Navajivan Ras, but it can be in some other formulation also?
So
or
many
it is-
formulations are there. We are selecting the drug. Generally Kupilu is not given directly. Preparations are given. So I just inform. In the treatment we will discuss this one. Over? Shall I clean? Any problem?
No, no.
Okay.
Sir, but is there any reason why we give Kupilu and better not in one type and in the
In vishwachi neuralgic pain, mainly kuchla works on the nerves.
Yeah. Little loudly. She'll understand.
In vishwachi, they have mentioned there is a neuralgic pain. Kuchla mainly works on the
Kuchala's property, actually it is very dry and ruksha vata karaka. But with the preparation, it is very good Vatahara, Vata Anulomaka, and not Shotahara. But there is no Shota or other things in the vishwachi. Only nerve is affected. Here Snehana, along with the Snehana Svedana, Kuchala makes Vedana Shamana better. Vatsana by serving was Vedana Shamana better. It is in the Vata Vidvamsana. The combination works along with the pathology total in the disease. According to that one, Vata Vidvamsana is better there. In the combination it is different. Combination, how they do, there are concepts behind that. If you see the effectivity of each medicine, you will find this one is better here. Which one? Oh, it's okay. Okay. Navajivana is better in the Vishwachi.
Sir, herbal medicine, you will tell treatment.
I will tell later. Which will come. There is common concept which we should to be. So there are 2-3 classes will be there. First is theory of the treatment. Next will be the medicines. Then you can understand the difference between the medicines. Now we start treatment. Vata vishwachi chikitsa. Anybody can tell what is the treatment of Vata vishwachi in general? Okay. Okay. Over.
Vata Anulomana.
Okay. What are the Vata Anulomana? What are the Vata Anulomana? Which reference you are telling? You are in MD. So please tell me which, according to which reference you are telling this statement. Where it is written?
Chakradatta.
Chakradatta. Okay. Still more. The best concept of treatment written in the BHATT. What are the treatments are done? This is confused. You are right. You are not wrong. But we are just closing our eyes in the total points. There are so many factors. All are used in the Vata vishwachi. Bad. Just like in Sweden. Abhyanga, Samardhanam, proper squeezing of the body or muscles. These are the Prakupita Pavananam Shanti Etani Kuri. Now, where this is typically used, this is important. When there is Nirama and the patient is Krisha, then always use these three. Madhuramla Lavana. Snigdha, when the parts are getting dry, shosha is developing in the Vata vishwachi, movements are less and becoming stiff. Then Snigdha Ahara, Snigdha Prayog, Ahara, medicine and Abhyangari. Nasya, when more related with the Urdhvajatru, then Nasya is the best one. And Ushna, whole body, stiffness, Graha and Stamba. These are clear from the Ushna. So, Ushna Ahara Padartha are given. Nidra for Vata Shanti. Movements makes more. This is rest, proper rest. And Guru for the Poshana. And Vata Shamana, Vata Anulomana. And Ravikara. This is one type of heating, Svedana. There are different, these all are different type of Svedanas. According to the conveniency, this can be done. Sometimes we are unable to give Svedana, Parishakada. Then with the Guru Pravarna, it is another one. In the black blanket, wear it and sit in the bright sun, then there will be very good fermentation. This is very, if the patient is having stamba, graha in the multiple joints, maybe in the vata rakta, then you can give Guru Pravana and sitting in the sun bath. Then sunlight effect will be lesser, heat will be more. So patient get relax. I have seen in local peoples when they are in the winter season having this joint stiffness, they have the blankets where it is available. Very hot blankets are there, rural made one, black. They wear it and sit. Within few minutes they are perfect. Generally after the lunch. After lunch or in the time of 11, 12 o'clock, they sit and feel fresh. You see some local
Shepherds.
ladies having that black shawl.
Shepherds.
Shepherds are there.
Like,
And
sheep hair.
I did from that, made from that. They are also having, but particular community is there. They are ahir, male and ahir. They are using that blanket as a routine. It is very hot. And basti, you know, Swedana. This is the ceremony running in the food. These are this one. See, if the patient is having sprain, one example is a sprain. Sprain is the stiffness in the generally in the lumbar area or in the cervical area. It is having generally short history. The stiffness is the main problem with the pain. Now, what you can use it? See, in the Ravikara or Swedana and Ushna Upachara. Give rest. Then we give Seka. And Samarthana also we can take it relief. Sushruta.
Shosha was a sir.
Shosha here. This is sitting near the fire. It suck. So name is here Shosha. It's all related. Three all related to the fire. Dahana, directly giving hot combination of sand or ash. That Jalada Parisheka. Shosha sitting near the hot item. Sushruta, more than that, Sushruta given Raktamokshana chikitsa vata vyadhi, Agni karma, Kshara prayoga and Siraveda. This is typical reference from the Sushruta. I have not done this, I will say. And Dr. Kalpana Raje in anatomy section, she is physician. She knows this karmas for some diseases. In the Vata Vyadhi, she is doing this Jalokacharana or Raktamokshana. Kshara Prayoga I have seen from other doctors. I am not. Kshara Prayoga, Siraveda, Agni Karma generally done in the Vata Vyadhi. Sciatica pain, in university also they are doing it. Next, according to Charaka, he is giving which type of sneha are important in the Vata Vyadhi. That is Tarpe, Taila, Vasamaja, all four snehas. This is food snehas, food type. These are used. Majja, Seke, Abhyanjanam, Bastaya, Basti, Seka, all the items. Sneha, this one, all four can be taken. Snigdha, Sweda. Sweda also, it is Snigdha Sweda. Apply the oil, then give Swedana. No dry, direct Swedana. Or Taila, hot Taila also we can do Swedana. Nivata, there is no movement of air. Wind is not there. That they can stay. Sthanam, Pravaranancha, Guru Pravana. Rasaha, Payamsi, Rasa, Mamsa Rasa. Soup, mutton soup. Payamsi, Kshira. Bhojyani, these are given in the food. And Swadu, Amla, Lavana, these are for the samskara and combination of soup or any other food items. Brahmanam, Yat Tat Sarvam Prashasta, which is getting Brahmana, increase our body mass. That all are good in the Vata Roga. This is the principal ideas. And he is not telling where this is given. Next, in the next section, he is telling how these are differently used. Okay?
So that Shara Prayog is not part of Vata Anuloma?
Which one?
Shara Prayog.
I am not mastering that one. Sushruta is told this one. Kshara is Vata.
Yeah, it's Vata Anuloma and it's like Sara, no? It's doing
Vata Anuloma and Vata Hara also. Sushruta is this one. I am not sure how these are used. is given in which disease, which kshara is to be done. Agni karma is told, Shiraveda is told. In different, in Vishwachi also I think there is Agni karma is there. Rudrasi and Vishwachi. Different. You refer the book.
सर
Over.
रक्त मोक्षण में हम रक्त निकालते हैं शरीर से,
हाँ.
तो वो खुद ही एक बात प्रकोप का एक निदान है,
Correct, correct.
तो वो इसमें कैसे
It is one of the Vedana and it is very dangerous. It is pranayatana. How this works I am not knowing. But he is referred this one and they are limitedly removing the blood, not much. Generally this is removed from the Kalabu or Jalauka. In the Siraveda more blood is removed. So in that condition, according to the Varna or recovery, they in the experience they remove only little quantity of the blood, temporary. Much quantity may be fatal. So in that one, dosha, visha will be reduced. That much will not increase the vata immediately. And then they give the food which is vata shamana and rakta prasadana. That is the theory in that one. Those who are practicing they can do. So you can see. I see only one person, Kalpana Radhe, in the P.S.N is doing, and Dr. Pasmina Joshi. She is practicing in other vata vyadis, joint pains, they are Agni karma. Jalokacharana they do. Generally they do in the vata rakta and skin disease. Okay.